I'm here with policy analyst and government affairs coordinator Leah Byers. A lot of people are talking and thinking about healthcare at this time, particularly during the coronavirus crisis. And I just think that there's, one of the things that we neglect is that if people are losing their jobs, it's potentially the possibility that they could lose access to healthcare. So I think a lot of people are just thinking about this issue in general right now. And we're going to talk to Leah about how government can help and how it can hurt during this time. So, Leah, I wanted to ask you first, how does government artificially restrict or regulate the healthcare supply, and why do they do it?
Yeah, so in times like this, we're all kind of paying attention, right, to how much healthcare supply do we have in the state? Are we going to have enough to face this crisis? And even though that's a pressing issue right now, it's been an ongoing issue for some time, I think, in North Carolina. And part of the reason why the answer to that question could be we don't have enough supply is because of how the state government puts limits on healthcare supply in the state. And there are several ways that does that: overly burdensome regulation, literally in the case of certificate of need regulations, putting limits and making healthcare providers get permission for the facilities and equipment that they own and operate in the state. And so there are kind of some indirect ways where they can discourage supply, and there are some direct ways that they actually do limit supply in the state. And as I said, that kind of comes to the forefront during circumstances like this. It raises questions of how prepared are we as a state to meet this crisis? And it also raises questions, I think we'll be asking these questions for a long time to come, about could the state have gotten out of the way in order to have more healthcare supply in the state?
So I noticed some states are changing their mandates about the number of hospital beds and certain equipments and certain medical apparatuses they can have on site in certain facilities. Tell us, what are con laws and what does that have to do with coronavirus? Because we keep hearing that term in the news to some degree.
Sure. So certificate of need, or con laws, as you said, are basically government permission slips that healthcare providers have to get in order to operate certain facilities in the state, or even own certain equipment in the state. So one example is an MRI machine that we're probably all familiar with. If a hospital feels that it needs to get a new MRI machine, it would have to get permission from the government to do that. The government would have to say, yes, you do need that, or no, you don't. And that's a very long battle that can have appeals, can take a lot of time and money. And so you can see how that would prevent, especially smaller providers, from being able to compete and drive down prices. Now, in North Carolina, the government agency that regulates certificate of need has put out a special sort of waiver on what are called acute care beds, which these are hospital beds that coronavirus patients are going to be in or treated in. And it has waived the certificate of need requirements for expanding your bed capacity. But even within that regulation, waiving the regulation, it says you still have to get our written permission. So you don't have to go through the full process, and it's not permanent, but you do still have to get permission from the government, even within what they're calling a waiver. And so another thing is the waiver so far is very limited to acute care beds, which, as I said, is good for corona patients directly. But what we're not considering with that is, if we can send a patient that comes into a hospital for, say, dialysis, if we could send them to another center for dialysis, or comes in to get an MRI for something non-corona related, if they could go somewhere else besides the hospital, it's better for the hospital because we're not overwhelming their capacity. And then also it's better for the patient, who might not risk getting the coronavirus from being in the same facility as the corona patients. And so I think expanding certificate of need, the waiver to include all things currently covered under certificate of need, would certainly help, in my opinion, to open up healthcare supply right now.
And just a reminder, Leah has written about all these issues. You can find it at nccivitas.org. I wanted to ask you too, because this is a term we hear about, but I think we're hearing about it more now during this coronavirus scare. But what about expanding scope of practice? Some people might think, oh, no, don't do that. That's your physician assistant's going to be doing your triple bypass surgery or something. Explain, scope of practice and what that means and how that can help out with this coronavirus situation.
Yeah, so the rationale behind expanding scope of practice is that there are certain healthcare professionals below the level of a physician or medical doctor that are operating in the state that are not currently able um, to practice under the full scope of their training. So they were trained to do, XYZ, but right now the state law says that they're not allowed to do that. And so one example, let's look at pharmacists, for example. Right now, some pharmacists are eligible to give out flu shots. Maybe you've seen the signs at Walgreens, right, where you can go get a flu shot. But why not let the pharmacist also give tests for the flu and prescribe, Tamiflu or whatever the flu medicine is that everyone takes, because they already know if you have the flu, this is what you're going to need. And so why not be able to let them go ahead and test in the pharmacy? And again, it kind of goes back to that healthcare capacity question, where if we can get people who have the flu, who have strep throat, who have these other non-chronic diseases to be going to the pharmacy instead of the doctor's office, it frees up the doctor's office to take care of corona patients, and it reduces the risk of corona transmission to these other patients who maybe already kind of have a suspicion, like, oh, I've had strep throat before, so I know that's what I have. I just need to get tested so I can get a prescription. Opening up pharmacists to be able to do that. Another example where scope of practice could really be opened up in the state is for advanced nurses. So there are several different classifications of nurses that are, kind of those advancedly trained nurses that are not currently able to practice within the full scope of their training without direct supervision from a physician. And the problem with that right now is that physicians are pretty tied up, right? Like they're pretty busy, and some of them can be hesitant to take on some of these supervision responsibilities during times of crisis. And so you can have nurse practitioners, for example, other advanced nurses that aren't able to even go and volunteer because they can't find a physician that's willing to sign on as their supervisor right now. So those are kind of two prime examples, I think, where the state could act and potentially open up the healthcare workforce.
Yeah, that's a really good point. Those are helpful. I think too, some of these laws and regulations that are on the book, it's before we had access to just more information about medicine, and we were able to do our own research online. And while you certainly want the guidance of a healthcare professional, and people know more about their medical history and more about symptoms because of just some of that access. And I think that allows for a little bit broader scope of care, in my opinion. But anyways, lastly, Leah, telemedicine is becoming more popular, and obviously people are going to be utilizing it more during this quarantine. What ways can government help to expand that practice? Is government even involved in this area? Help us understand that.
Yeah, so right now, the number one thing that the government could do when it comes to telemedicine is opening up telemedicine to uh, healthcare providers in other states. So right now, you have to have a license in North Carolina to be able to see patients in North Carolina, that even if you're seeing them remotely. And we need all the healthcare providers that we can get. And so if you have someone that lives, say, for example, near the South Carolina border, and they want to see their physician via telemedicine, right now they would not be able to do that in North Carolina. They would have to go there. And so it's just another way, as you said, during the quarantine, to keep people inside but get them access to the health care that they need during this time. And we certainly don't want to put over, like, there's going to be a temptation if you start talking about telemedicine to over-regulate and putting requirements on telemedicine that can make it just as expensive as regular medicine, which kind of defeats some of the innovation and cost savings that we see from this method. So yeah, those would be my two recommendations when it comes to telehealth.
Excellent. Thank you, Leah. You can see all of our content nccivitas.org. We've got a lot of policy recommendations out there for coronavirus crisis, and we appreciate your time today. Thank you.